Hello, everyone. I'm Janelle Mose, the Advocacy Director with AARP North Dakota. AARP has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP has canceled all of our in-person events until the end of the year, but we're finding other ways to continue to provide information and resources to help older adults and those caring for them. We're hearing a lot about the need to practice social distancing during the COVID-19 pandemic. Staying in touch and connected with loved ones while taking the precautions recommended by the Centers for Disease Control and Prevention can present many challenges. This social distancing can be especially difficult for some older adults. Social distancing is better described as physical distancing required to prevent the spread of coronavirus. People are social creatures. Our connection to others enables us to survive and thrive. Social engagement has benefits to our overall well-being. Now, with COVID-19, the risk of infection brings the risk of social isolation and loneliness. Research has shown that loneliness in older adults can cause poor health risks such as cognitive decline, depression, and heart disease. Older adults most vulnerable to social isolation and loneliness are living alone, those with no close family or friends, the homebound due to health or mobility issues, and those facing challenges related to socioeconomic factors. With me today is Katie Jonke from Bismarck-Burley Public Health and Chandra Zeman-Belinsky from NDSU Extension, Burley County, for part one of a series to talk about meaningful and productive ways to stay connected to family, friends, and neighbors during this time of physical distancing ourselves from others. Welcome, Katie and Chandra. Thanks for joining me today.
Thank you for having us, Janelle.
Thank you.
So I'll start by talking about, the first cases of COVID-19 were reported in North Dakota in mid-March. And although many businesses opened back up in May and many older adults and those supporting them, continue and will likely continue to stay at home and physically distance themselves for others. Katie, what are you seeing here in Bismarck-Burley from the public health perspective?
COVID-19 has certainly affected us all in many different ways. And we are now about 7 months into this pandemic, and what we are seeing in the community is people really wanting to resume some sense of normalcy with their day-to-day lives. They want to be able to see their loved ones, go to the stores regularly, meet with friends, go out in public. And as public health continues to learn more and more about this, the best way that we can balance health and safety for all with normal living, we want to encourage everyone to do their part and keep our community healthy. And one of the biggest reminders we have is that social or physical distancing from others, as you just mentioned, Janelle. This can really take a toll on an individual, however, whether it's a young preschooler or an older adult. It really doesn't discriminate against age, and we as human beings are social beings. And when there have been barriers put in place, limiting those interactions with others, we are faced with during this pandemic, it can have a toll on our health and our mental health. And so this is why it is so important that we push ourselves to find new ways to engage with others and make meaningful connections with our loved ones. And this is the very reason Chandra and I are here today to talk about the reality many people are facing during this time, and not just older adults, but their families and the importance of staying connected.
You brought up some really helpful and important points, Katie. I think you're right. Being 7 months into this, there often tends to set in a bit of fatigue. People want to get back to normal, but knowing they still want to make good choices for their family and friends. So Chandra, can you describe a little bit more about what Katie was talking about, but how does living alone and isolation affect people?
That's exactly right. Isolation greatly affects people. Stress can be described in the situation by feeling overwhelmed by the situation and feel like you don't have enough resources, which adds to that, resources such as money, health, or family and friends to deal with it and support you through it. It comes across as worry, anxiety, or fear. And that's the result when thinking about the future of not being able to reach out to loved ones or get help if needed. A feeling that you can't stop worrying and it just continues, which keeps you awake. Depression can even result because we're wired for social connection, just as Katie had mentioned. When we feel unconnected, unimportant to anyone, to the world, we can start to feel that no one would notice or care if you disappeared. And so it's sort of a continuum and it can worsen. And I do have to add quickly that it has been a few months since I have been able to go into where my grandma lives in an assisted living community. And I can actually see a significant difference physically with the folks that I was able to visit with finally after a few months last Friday. So,
I mean, that's incredible. We hear those stories every day about finding unique or different ways, and then once you do get to reconnect with that person you haven't seen face to face, just the significant difference that it makes both for you and that person you're visiting. So, I think what signs should supporters look for if they're concerned about a family member or a friend, Chandra?
right, great question. And actually, it can be as simple as knowing that you are the most important person today to somebody. So, you are the front line to many living at home, or maybe that first contact, and who is isolated during this pandemic. So you make a difference in their life and their day, not just with the gifts you bring. You can make a difference when you connect with them person to person. And that can be in many different ways, even over the phone. So you are the most important person today.
I think it's just a natural instinct that, we want to jump in and help someone when we see them in pain or experiencing stress. Why do we try to fix things? And is that the best route to go?
Right. Most of us want to naturally jump to aid when someone is hurting. Some of us call ourselves fixers. And the truth is, we usually have the answer inside of us, or individuals do. And sometimes we just need to air it out or talk it out and be able to find it within ourselves through our own dialogue. So, you know, people want to be validated, but allow them to speak it out.
Thank you, Chandra. Katie, let's bring you back into the conversation. I think, what do we want to look for recommendations, or are there ideas you can share for family and loved ones about how to stay in touch as we continue to move through this pandemic and know that we're moving into the fall and the winter season?
Absolutely. And everyone's situation is unique, and older adults have very different needs and desires regarding social engagement. And so I would say to older adults looking to keep in touch with their family and friends, use a method that works for you. So whether that's phone, text, email, video chat, there's a lot of options, and we have a lot of opportunity here in the year 2020 for technology and connection, which is a great benefit during this time. And so with that, if you aren't engaged in one of those platforms for reaching out that can't be done in face-to-face, maybe this is an opportunity to learn new technology. And there are a lot of resources out there, and you don't have to be tech savvy. This could be an opportunity to engage maybe with your grandchildren and have them teach you how to text, how to use video chat, or simply go back to the phone call. And I think if you really reach out and express your concern or you're wanting to engage, your family members will be more than happy to accommodate the method that works best for you. You can also stay connected to the community from your home. And so don't disengage from the community. This is the most important time to be involved in your community. Just find the way that works best for you. And there's a lot of opportunities through online book clubs, faith-based groups that are doing things virtually, nonprofit groups that rely on some volunteers during this time that can be done from the comfort of your own home. And then engage in activities with a social aspect as well, just to continue to have that connection with others.
Those are really excellent tips, Katie. I think people forget that they can often do things and still stay connected and be involved in their community, even if it is, from their own home. There's a lot of safe ways to still stay connected and engaged. So, are there any other advice or suggestions that you have for family members of older adults?
Definitely to be intentional with making contact to your loved one, and even more frequent during this time. We all get busy, and even as things have slowed down a little bit, we're finding, I think, new ways to become busy. And so don't forget about those opportunities to connect, and remember those that may be a bit more isolated during this time. And so really make it a point to connect, whether it's putting it in your calendar, or setting just a weekly time to connect, or daily. And if they do, you can send them a quick text, or write them a letter. All these avenues that you can reach out. Use multi methods to reach out and connect with them. Definitely challenge your family members to get involved too. And maybe it is a schedule between siblings or extended family to reach out and connect. Face-to-face contact obviously is going to be the best way, but when that is not possible, look to those other options, as I mentioned, as a way to engage. You can also promote that intergenerational connection, and I really encourage family members to engage their children to reach out to the older adult in their life, and make this an opportunity to really connect with one another. I think now it's important all the time, but really now more than ever to connect with those different generations. And then if your loved one is in assisted living or nursing home, reach out to the staff and see what options are available. And it may change from a day-to-day or week-to-week basis as we navigate this pandemic, but stay involved with their facility and see what options are available for them.
I think you're right. I think the situation changes day to day, but I think that intergenerational connection has really come to life in the last 7 months. I did an interview with George, one of our volunteers, and his grandson who was in South Dakota, and you could just see both of them light up knowing that they could see each other even though they were hundreds of miles away. So I think if we can find really, even if it's just short amount of time to reconnect in a way using technology is so key. Any other tips that you'd like to share, Katie, for our viewers, just about regardless of age?
I think it's important to remember that we are all in this together. No one is in this alone. And now more than ever, we need to find creative ways to be connected across the community and across our families. And so know that this is temporary. Even though it may not feel like it, it will pass. And it's just important to maintain that sense of hope, stay positive, and have that sense of gratitude for where you are at right now. Talking with loved ones and families about your concerns and fears is definitely something you should do. To talk through this with one another will get everyone through this together. And then if you are struggling, find a trusted person to reach out to, whether it's a pastor, a mental health professional, a friend, just anybody in the community. You can reach out and share your concerns because you don't want to bottle this up. We all need to get through this, and there's a lot of resources available, whether it's a family resource or a community resource. So just stay positive.
Thanks, Katie. I think we often need to remind ourselves that this is temporary. It doesn't feel that way, but I think the more that we can continue to just, stay connected and move through this together, we will see better days ahead of us. So thank you again, Katie and Chandra, for joining me today. For our viewers, please stay connected with us here at AARP North Dakota. You can connect with us on Facebook. You can also like our page and find all of our upcoming events that are online now through the end of the year at aarp.org/ND. So thanks again for joining us, and stay connected with us here online, and we hope to see you very soon.